Good day everyone. I am Swati Kumari, Assistant Professor in the Department of Medical Imaging Technology from Yenepoya School of Allied Health Sciences, Yenepoya deemed to be university. So today we will be learning about four vessel angiography. So at the end of this session, the student will be able to define what is four vessel angiography, indicate when to perform the procedure, explain the procedure, and explain aftercare and complications of the procedure. So these are the contents we will be discussing today: the definition, anatomy, indication, contraindication, patient preparation, equipment, technique, aftercare, and complications. So starting with what is four vessel angiography. So it is basically the study of the vessels which carries the blood to brain by injection of the contrast media into it. So coming to the anatomy, here you can see on the right hand side the image. So try to follow up with me. So starting with the bottom, we have the aortic arch which divides into brachiocephalic and left common carotid artery and left subclavian. Now further moving from brachiocephalic, it further divides into subclavian, right subclavian, which further divides into right vertebral, and as you move upwards it divides into right internal carotid, and further it gets connected with the anterior communicating arteries. Whereas on the left hand side, the left common carotid artery further joins up and becomes left internal carotid artery, which goes and combine again with the anterior communicating artery. So coming to the indications of the procedure, first we have is aneurysm, that is the bulging of the blood vessels. Then we have as AVM, that is arteriovenous malformation, that is the malformation of between the arteries and the veins. Then we have as atherosclerosis, that is the plaque formation in the artery. Then we have a stroke. So in stroke we have two types, one is ischemic stroke and the other one we have is hemorrhagic stroke. In case of ischemic, there is an obstruction in the flow of the artery, and in case of hemorrhagic you have the weakened vessel where the walls ruptures and then it leads to bleeding in the brain. Then other indications are brain tumors, suspected clot, thrombus and embolus, and AV fistula. Coming to the contraindications of the procedure, so first one we have is bleeding tendency or the patients on anticoagulant therapy, history of any contrast allergy, impaired renal status, pregnancy, skin infection or swelling at the site of entry. So coming to the equipments required for the procedure, we have C-arm unit, ECG monitoring, arterial puncture needle, so we can use either 18 gauge or 21 gauge. Then we have guide wires, sheath, dilators, syringes, local anesthesia, that could be 1 to 2% of xylocaine, normal and heparinized saline solution, surgical pad and gauze pieces, and catheters. So in catheters we have three types of catheters which could be used for the procedure. So the first one we have is headhunter catheter, second one we have is Simon's catheter, and third one we have is Betson-Hanafi-Wilson catheter. So any of the three could be used for the procedure. Coming to the contrast media, so we use non-ionic contrast media which are more safe and less allergic to the patient. So for diagnostic angiogram we use Omnipac 300 mg, and for neurointerventional procedure we use Omnipac 240 mg. So patient preparation, so when the patient comes for the procedure, initially we take the patient history and the clinical examination is done. Then we explain the procedure to the patient. After explaining the procedure, we take informed consent from the patient. Then the patient should be well hydrated, fasting for 4 hours prior to the procedure, and we need to shave and clean the arterial puncture site, and xylocaine sensitivity testing is done. So following investigations has to be done. So we have HB, ESR, platelet count, PT, PTT, BT and CT, HBsAg and HIV. So on the right hand side you can see the normal range of these tests. Then coming to the history of the drug intake. So if a patient is on warfarin, it should be stopped 4 to 6 days before the procedure, and if the patient is on heparin, it should be stopped 4 to 6 hours before the procedure. So coming to the imaging technique, so imaging technique we use is DSA, that is digital subtraction angiography. It is a technique which provides better visualization of contrast filled vessels. So here we acquire two images. The first one is the pre-contrast image, that is without giving contrast, and the second one we have is the post-contrast image. Now we will subtract both the images and then we will get image with a clear picture of blood vessels. So here you can see we have a post-contrast image which is being subtracted from the pre-contrast, and at the end we have a subtracted image which suppresses the background and just highlights your blood vessels. Coming to the approaches, we have four types of approaches. We have femoral approach, which is the most commonly one as it is easily accessible to the site. Then we have brachial artery approach. Then we have axillary artery approach and carotid artery approach. Now coming to the procedure, so initially the patient lies on supine on the angiographic table. Once the patient is lying, we will put the safety straps will be put on the patient's head to make it immobilize. Then we will be placing the ECG leads on the patient's chest to monitor the electrical activity of the heart. And also we will be connecting the pulse oximeter to the patient's finger for the measurement of oxygen level. Now we need to prepare the area for procedure in the sterile condition. So initially we will be placing a sterile drape. After placing a drape, we will be cleaning the site with the betadine. After cleaning site with betadine, we will be injecting a local anesthesia. And once local anesthesia is injected, then a small incision is made at the puncture site. So once the incision is made at the puncture site, then we perform the Seldinger technique. So in Seldinger technique, what happens is, first we will be identifying the artery for the puncture site. Once the artery is being chosen, all those procedures what we discussed in the last slide will be done. After doing that, now we will be inserting our needle. So once we insert the needle, we will be removing out the stellate. And once you remove out the stellate, there will be a flow of blood from the needle. So if there is a flow of blood, it confirms that the needle has inserted in the right place. Then once the needle is inside, over it you will be placing a sheath wire, which we also called it as temporary guide wire. Once a sheath wire is being inserted, now the needle will be removed, and once the needle is removed, now only thing we have in place is the temporary guide wire, over which we will be placing a sheath. So once the sheath is in place, now the sheath wire, that is our temporary guide wire, would be removed, and then on that sheath which is placed in the artery, a guide wire will be placed. Once the guide wire is in the place of the artery, then we will be placing, then the sheath would be removed, and then we will be placing our catheter over it. And now this catheter would be advanced into the carotid artery, and then contrast injection is given and the further filming is done. So for filming for carotid arteries, we take lateral, AP axial, AP oblique, and the contrast media used is around 6 to 8 ml. And for vertebral arteries, the films we take is AP axial, lateral projection, so around 4 to 6 ml contrast media is used. So for filming under carotid artery, the first one which we take is occipitofrontal 30 degree cephalad, also called as PA axial. So this demonstrates us the frontal view of anterior and middle cerebral artery. Here you can see on the right hand side that image. Then the lateral film is to demonstrate anterior and middle cerebral arteries and carotid cephon. And the third film which we take is anterior oblique, that is cephalad angulation, which demonstrates internal carotid bifurcation, anterior communicating artery and middle cerebral artery. Then for the vertebral artery, filming we have is occipitofrontal 30 degree cephalad, that is PA axial. It demonstrates the branches of the basilar artery, posterior cerebral artery and superior cerebral artery. Coming to the lateral film for vertebral artery, it will demonstrate us the basilar artery, posterior cerebral artery. So the complications of this procedure could be puncture site bleeding, allergic reactions to the contrast, pseudoaneurysm, air embolism, or maybe hematoma. Aftercare, so we will ask the patient for the complete bed rest at least 4 hours. Then compression will be given at the puncture site for minimum of 20 minutes. We'll be monitoring the vital signs and we'll ask the patient to drink a lot of fluids to maintain the electrolyte balance. So summarizing, this is a procedure which is used to see the blood vessels which carries blood to the brain by injecting contrast media into it. And the indications could be aneurysm, AVM, stroke, AV fistula, and the contrast media which we use is Omnipac. These are my references. Thank you.